Bismillah ar-Rahman ar-Rahim. Ischemic heart disease first lecture. It will be about angina pectoris. Heart disease is the leading cause of morbidity and mortality worldwide. This lecture discusses the subject of the myocardial ischemia. Normally, there should be some sort of balance between myocardial blood supply and oxygen demand. Myocardial ischemia develops whenever blood supply is decreased or the oxygen demand is increased, meaning that we are developing some sort of imbalance between the blood supply and the oxygen demand. Examples on factors that will decrease the blood supply to the myocardium include atherosclerosis of the coronary vessels, coronary vasospasm, hypovolemia, or shock. Examples of factors that increase the oxygen demand in the heart include increased exertion, hypertension, stress, and tachycardia. The word ischemic heart disease describes a group of related conditions that all result from myocardial ischemia, an imbalance between the cardiac blood supply and the myocardial oxygen demand. In many of the cases, the word coronary artery disease can be used as an interchangeable term with ischemic heart disease because of the great association between coronary artery disease and those conditions. Ischemia of the heart can result from the following mechanisms: reduction in coronary blood flow, the most important example of which is atherosclerosis, and this represents more than 90% of all cases. The second mechanism is increased oxygen demand. Cases or examples of cases that lead to increased oxygen demand, as we said, include tachycardia, hypertension, and many other conditions. The third and the least common mechanism is diminished oxygen carrying capacity. This thing means that the blood supply is not really diminished and the myocardial oxygen demand is not greatly increased, but the imbalance is resulting from the insufficiency of oxygen supply inside the blood. This could be caused by some rare conditions like severe and sudden anemia, and also in cases of carbon monoxide poisoning, CO poisoning. As we said, ischemic heart disease is not a single entity. It encompasses a group of conditions that are all related to ischemia. In fact, there are 4 basic clinical syndromes of ischemic heart disease. These include angina pectoris, which is ischemia that causes pain but is insufficient to lead to the death of the myocardium. The second clinical syndrome of ischemic heart disease is acute myocardial infarction, in which the severity or the duration of ischemia is sufficient to lead to cardiac muscle death. The third condition is chronic ischemic heart disease, which is a form of progressive cardiac decompensation or congestive heart failure that follows acute myocardial infarction. The fourth condition is called sudden cardiac death, SCD. This is a form of death that results usually from a lethal arrhythmia that follows myocardial ischemia. Angina pectoris means that there's some sort of ischemic chest pain, and it's usually in the form of a crushing or squeezing substernal chest pain. Sometimes this pain radiates. It usually radiates to either to the jaw, the neck, the upper abdomen, the left shoulder, and the left arm. Both of those conditions, angina pectoris and acute myocardial infarction, are related to ischemic chest pain. So how can we differentiate between them? Angina, as said before, causes intermittent chest pain that results from transient reversible myocardial ischemia. So the ischemia here is enough to cause pain, but is insufficient to lead to the death of the myocardium, meaning that the ischemia lasts less than 20 minutes. So in angina pectoris, the pain usually lasts less than 20 minutes, and because it's related to transient ischemia, it can be relieved by rest or by certain medications like nitroglycerin. In myocardial infarction, on the other hand, the pain is related to irreversible ischemia, meaning that the ischemia is developing or it had developed at least 20 minutes before. So the pain here lasts more than 20 minutes, up to several hours, and is not relieved by rest or by medications. There are three types of angina. The first type is called stable angina. It's also known as classic angina, effort angina, and typical angina. The second type is called unstable angina or crescendo angina. The third type is variant angina or Prinzmetal angina. In stable angina, the pathogenesis is critical coronary stenosis. So there is narrowing of the coronary vessel by an atherosclerotic plaque. This condition is associated with episodic pain that develops with increased oxygen demand. Examples of things that lead to myocardial oxygen demand increase include exertion, tachycardia, hypertension, fever, anxiety, and fear. So there should be an associated or an underlying critical atherosclerotic narrowing. Because of this condition can be relieved by rest, which reduces the oxygen demand, or by certain medications like nitroglycerin. In Prinzmetal or variant angina, the pathogenesis is quite different. In this condition, the cause is a severe coronary vasospasm. That's why this condition can occur at rest or even during sleep. And even coronary vessels without atherosclerosis can be affected. The exact etiology is not well understood. But because we know it's related to vasospasm, it can be treated using vasodilators like nitroglycerin or calcium channel blockers. The pathogenesis of unstable angina or crescendo angina is the presence of critical stenosis with a superimposed acute plaque change. We mean by acute plaque change the development of certain acute changes that are superimposed on the already stenotic vessel. Those can include plaque rupture, non-occlusive partial thrombosis, distal embolization, and a superimposed vasospasm over the atherosclerosis. Unstable angina is the worst type of angina because it's usually associated with increased frequency of pain. It's precipitated by less exertion. The pain is usually more intense and of longer duration than stable angina. The causes are very important because they require attention. This condition usually precedes more serious and potentially irreversible ischemia, and that is why it is sometimes called pre-infarction angina.